Okay, so today we're going to discuss about the human herpes virus. Okay, so we have the family of the human herpes viruses. So basically, we'll be discussing about the cytomegalovirus, and we've also here the Epstein-Barr virus. Okay, so speaking about the herpes viridae, so the herpes viridae, this is the DNA viruses, basically, which is also an envelope na virus. So we have here the classification. So we have your herpes virus 1, that's your human, this is your herpes simplex virus 1, herpes simplex virus 2. Okay, the herpes virus 3 is your varicella zoster, the 4 is your Epstein-Barr, the 5 is your cytomegalovirus. We'll be discussing only the 2 here, Epstein-Barr, and we have the cytomegalovirus. Okay, the cytomegalovirus could be transmitted by the following. Number 1 could be sexual, could also be transplacental or congenital infection, and could also be transmitted by your blood transfusion, organ transplantation, and we have also your stem cell transplantation. And basically, the virus could be found here on the different, almost different body fluids in our body. Okay, now we have here the high-risk group here that would have a higher chance of contacting the infection. So number 1, we have here the healthcare workers, because we are the one working in the laboratory setting or the hospital setting where you've been exposed for the secretions coming from infected patient. Then could also have the immunocompromised patient. Immunocompromised includes number 1, pregnant patient. Then we have also here the newborn, the infants, and we have also the AIDS, HIV patient. Okay, for the prevention, okay, cytomegalovirus resides, the virus reside most likely on the leukocytes or WBC. So therefore, we could prevent the transmission here by number 1, transfusion of the leukocyte reduced na unit of the blood. In the blood bank we are preparing for the leukoreduce by the filtration process where you try to remove the WBC. Because again, the virus reside on the WBC. So therefore, you just need to remove the WBC. That could help prevent here the transmission. Second one, you could have irradiated blood because of course that could kill the virus. Third one, we could also have the passive antibody transfer. So you could for the passive immunity of the healthcare workers or those all the people to prevent the transmission. And since the virus here could be found in all the body fluids, so hand washing technique, you get also infected by the virus through your contact with the secretions. So therefore, hand washing could help you prevent the transmission. And of course, here the PP program would eventually really help here then to prevent the transmission. Okay, then we have here the latent infection. So again, the infection with the cytomegalovirus could go into a latent infection stage. Pag sinabing latent infection, the infection here do not have signs and symptoms. But it could also have the tendency to reactivate. Most likely, higher risk here of reactivations are those patient number 1, pregnant patient. Second one, those undergoing organ transplantation, blood transfusion, or stem cell transplantation. Higher risk here most likely found among those patients undergoing an allograft transplantation. So, especially if the patient has been previously negative for the infection and then a tissue or an organ or even a blood is positive for that could result here to the seroconversion from the seronegative na recipient magiging seropositive ang patient natin. Okay, then we have here, we defined primarily the latent infection. We have here the true definition of your latency. We define that one as the presence of genetic information in an expressed state in the host. What do you mean by that? So, when sabi natin presence of genetic information, so if we try to extract the blood of the patient, the virus is present in the secretion of the patient, only that one is in an expressed state. Mean to say that one, The patient here do not have or not showing signs and symptoms, but the patient is infected. Then we have also here the operational definition of your latent infection or the latency. So it's just a dynamic relationship between the host and the virus where it can go a latent infection, but again, would still have the tendency to reactivate. Okay, the next one, we have here the congenital infection. So when speak about the congenital infection, the mother during the pregnancy is infected. Okay, again, it could transmit the infection to the baby. We have here the mechanism of your congenital infection. It could be a primary infection. So speak about the primary infection, the mother has been infected for the first time or the first exposure, the mother. The second one, the mother has been infected already in the past that become recurrent, or you call it once the reactivation because of the pregnancy. So it can recur or reactivate the virus, so it could also become active. The virus become active again. For the complications, okay, the baby born out of the mother infected by the virus. If the baby is premature, the baby die. But if the baby could able to live or be alive during the delivery, okay, or the baby able to survive during the delivery, or like hindi siya premature. But then again, the baby will grow here with some mental impairment and some health abnormalities pa din. Okay, now we go to the signs and symptoms of the cytomegalovirus infection. So we have here the acquired infections. If we speak about the acquired, you could get infected here by the virus. Could either be by sexual contact or even by like contact with the infected secretion. Contact with the infected secretions. Okay, the incubation period for your acquired infection is 3 to 12 weeks. That's 3 to 12 weeks. Okay, manifestation, the patients may be asymptomatic, but in some patient would eventually would have your signs and symptoms. Pag may signs and symptoms ang patient, that may be in the form of your flu-like symptoms. The flu-like symptoms includes your fever, your headache, your malaise. You have also the splenomegaly, hepatomegaly. Splenomegaly because of the presence of the infection. So your spleen here try to be inflamed. Then we have also the hepatomegaly because again, this would have a liver manifestations. For the complications, we have interstitial pneumonitis, hepatitis, Guillain-Barré syndrome, thrombocytopenia, and thrombocytopenia, and we have also hemolytic anemia. Okay, so we classify, okay, also here your cytomegalovirus as having a hepatitis-like manifestation, infectious or immune, what you call that one? We have also here heterophil, antibody negative, and the infectious mononucleosis-like syndrome. Again, meron siyang infectious mononucleosis-like syndrome, hepatitis manifestation. So pag sinabing hepatitis manifestation, expect to have here a liver enzyme related to your liver enzymes increase. But then this is characterized by heterophil antibody negative. Negative siya for heterophil antibody. Okay, the next one we have here your transfusion transmitted infection. Okay, there are three mechanisms here for the transfusion-transmitted infection. The first one, we have the primary infection. So in the primary infection, the donor here is negative for the infection, but the donor's blood is positive for the virus. So immune response, okay, the patient would have here a seroconversion from being negative, magiging positive ang patient natin. Second mechanism here, transfusion, we have the reactivation. So the patient or the recipient is positive already in the past, but that one is in the latency period. So it could reactivate here once you transfuse the blood that could either be a positive or negative for the virus. Okay, immune response, we have here an increase in the antibody titer of your IgG. In the case of your IgM antibody, that is negative for that. And the last one, we have here the reinfection. The reinfection, the recipient is already positive. And the donor's blood is also a positive for the virus. Only that they are of different strain of the virus. Different strain of your cytomegalovirus. So for the immune response, so basically we have here the increase in the IgG antibody titer. IgM antibody here could be a positive or negative. Again, it's just differ with your reactivation because in the reactivation, your IgM is really negative. Ito naman, it could be a positive or it could also be a negative. Okay, the next one, we have here your congenital infection. So, pag sinabing congenital infection, so again, the mother is pregnant and infected, ang mother. Again, it could transmit infection to the baby. For the classic congenital cytomegalovirus transmission or infection, the following will be manifestation. Number one, the patient would have here the neurological manifestation, neuromuscular, splenomegaly, hepatomegaly, jaundice could also be present, and 50% of the newborn infected by that would have a petechiae. Then we have here another complication. We have the CID or cytomegalic inclusion disease. This is a fatal form of the complication related to your congenital infection. Characterized here by intracranial calcification, mental retardation. We have also visual defects, hearing defects, and meron siyang motor dysfunction. Okay, now we go to the immunologic manifestation. So, in the case of the infection, so they will have here an alteration in the immune response in the case of the infected patient. This is characterized here by alteration here in the, we have here the T helper subset population characterized by the decrease in the CD4 and we have increase in the CD8 positive na cells. For serological markers, first we have here the different antigens produced here in the course of the infection. This antigen could be found here in the nucleus, except your late antigen, where it could be found here both in the nucleus and in the cytoplasm. So the immediate early antigen is basically being produced here within 1 hour of the infection. The early antigen is being produced here within 24 hours of the infection, and the late antigen is being produced here within 72 hours of the infections. Okay, for the antibodies, okay, antibody produced here related to your immediate early and early antigen signifies an acute infection or the early infection. And antibody produced here only for your early antigen signifies viral shedding or the active infection. And antibodies here to your late antigen signifies convalescence or the recovery. We have also here hematological tests. So we have here the presence of the lymphocytosis with the presence of the variant lymphocytes. Almost 20% of your lymphocytes are atypical lymphocyte or your reactive lymphocytes. Another one, we have here your heterophil antibody negative. So this would differentiate this one from your your Epstein-Barr virus because Epstein-Barr virus is heterophil positive. Then we have also here hepatitis manifestation. So expect to have here a high level of the liver enzymes. Your AST, ALT, and other liver have we have here the laboratory test for your diagnosis of your cytomegalovirus infection. So if the patient is immunocompromised, so do not rely on the identification of specific antibodies or antigen. So you could have your viral culture. You could also have the molecular diagnostic test, which is much sensitive and specific for the infection. We have here your PCR. Again, the viral culture will be specific for that, only that is impractical because of, again, the result here is medyo matagal siya because you need to culture the virus. Example of your agglutination test for detection of your antibodies, yung mga antibody to your immediate, early, and late antigen. We have here your positive latex agglutination test. This one is a positive because, again, you are detecting for antibody in the patient sample. So pag reverse passive siya, you are detecting for antigen. Since you are detecting for antibody, become a passive. Latex, because again, your antigen reagent na antigen here is adsorbed in your latex particle in order for that to have a larger surface area that would allow you to identify the presence of your infections. And this is agglutination test, so the positive result here would be agglutination. An example for that, we have the cytomegalovirus card scan test.